At the G20 Summit, Chinese President Xi Jinping proposed to the world a global QR code system as a way to help open up travel amid the pandemic. It involves a mechanism that would allow global recognition of a person's travel and health records, including COVID-19 test results. QR codes are in widespread use in China and certainly increasingly over the world. Since February, they've been used to provide a person's health status and travel history in China. Getting a green pass after scanning a QR code in China, meaning a person is healthy and can travel despite the pandemic. While a yellow or red code means individual has to be quarantined. Because using QR code do not require physical contact, it lessens the risk of virus transmission. Well, that at least is the argument for the QR code. To understand better about this debate and whether that idea will work, not only in China, but also on a wider basis in different parts of the world, let's loop in our panelists who definitely have their own attitudes. For more on the global QR code system, joining us in Beijing, Dr. Jay Huang, founding partner of J-Stone Capital and former managing director of Intel China. In Bangkok, Jeffrey Towson, former professor of Guanghua School of Management with Peking University. Last but not least, in Atlanta, Chen Zhuo, associate professor from the Department of Health Policy and Management, University of Georgia. Gentlemen, welcome to the program. Certainly, that is an interesting proposal, isn't it, Dr. Huang, about proposed by China about a global health code system so that people beyond border could travel freer than it used to be.
Yes, I think that's a very interesting proposal. Probably never heard about it before. As we all know, under the barcode and in China during the pandemic and has been widely used and has been proven quite useful to track the people where they are. And then if they have been in the area which have the COVID-19 victims, and then the people will require to quarantine for like 14 days. So this practice is quite common in China, but don't know how useful it would be across the border.
Well, that is a debate going on, Mr. Towson, about what can be accepted by individuals given their very different political system and top concerns. So what do you make of that?
Well, I mean, it obviously is a political question. It's also cultural. Certain countries, certain cultures are just
it's
more
not a health
comfortable
question
with this than others. It's both. I mean, it is a health mechanism that has some degree of effectiveness, but it's not the only one. And there is going to be some trade-offs between various countries. The US is probably not going to go for mass contact tracing. A good portion of the population wouldn't accept it. Other countries like Japan, we see widespread adoption and it seems to be okay. So there's going to be a trade-off. It's a political question, country by country. But you can definitely see that this is going to make a lot of sense for certain countries that have this system. If Japan and China want to start doing more tourism, and both countries are already comfortable with this system, suddenly that opens the door to things like, okay, let's open some trade and tourism between the countries again. I mean, in that case, it starts to make a lot of sense.
Professor Chen, it's very interesting now in sporadic countries around the world that COVID-19 prevention control so far has been successful. So do we see the possibility of using the QR code system among these countries and make travel freer, easier?
Yes, I do think that such a system would help to ease the travel restrictions. It's where contact tracing has been proven to be very effective to help to identify who might be at risk of being infected. And this is going to help in terms of mitigating the impact of the pandemic. And I think having such a system would definitely help to facilitate the travel people and also over goods.
Mm.
But I do agree with Dr. Townsend that there's a lot of things that we have to consider, whether it's political and cultural. And in the United States, I think there's a lot of resistance to share the information with a centralized system, whether it's a government or a private company. I think there's a lot of hesitation towards that aspect.
And that's the fascinating part of this discussion, isn't it? Dr. Huang, you have been in China over the past year, so you know how the QR code works.
I think in China, almost everybody have to download the application, and then coming from different sources. Some of it is from like a central government and agencies, some from provincial government, and some are from the popular like WeChat organization, etc. And then people are using this app and to show where they have been. And then if they go into a shopping mall, for example, and then they have to use this app to scan a barcode. And then the shopping mall owner or shopping mall organizer will know who actually come into the mall. If later on they found out and somebody in the mall during the same period of time has been tested positive, for example, people can tracking out who have been in the mall during the same period of time, and then have to follow on you and then ask you to be quarantined either in your home or in a designated places like a hotel or whatever for 14 days. That's how things get carried on in China.
Of course, it is not done without any reluctance. For example, when some detailed questions are too much when it comes to privacy, there are also a resistance coming from individuals. For example, I have been asked with questions that I do not see as relevant, not about the QR code, but rather of some kinds of questionnaire designed by any individual organization. Once you come into their building, I could ask these questions to them and say, these are the things that I do not want to ask you, and I do not feel the responsibility to answer you. And they sometimes adjust the policy. So it's very interesting, Dr. Huang, just to go further into the discussion, how a general framework can be established and how much nuance actually exists within this general framework, Dr. Huang.
I think the practice here leave people pretty much with no choice but follow the rules. For example, you want to do shopping or you want to go in a restaurant. Before you can get into the restaurant at the doorsteps, you have to show you have one of the apps. You have to scan their barcode. Otherwise, you cannot get into the restaurant, get the services. Similarly as a shopping, etc. And also the buildings, if you want to visit somebody and in the building, you also have to do this. So you have literally no choice but follow the rules, regardless if you like it or you don't like it.
I don't agree with that at all.
Go ahead. Go ahead, Mr. Townsend.
I mean, you can say that if you're a restaurant and you say you must QR code to come in, certain people like myself would say, okay, no thank you. Good luck with your business. There's lots of restaurants in this world. I can eat at home. So I think the businesses would bend very quickly, which is what has happened in a lot of countries. And I've done the same with office buildings when they say we need to scan your passport. It's like, you're not scanning my passport to come in. So it's not one-sided, but it does depend on how much the government enforces it. If the police are out there enforcing it, okay, it's probably going to happen. If it's just the businesses, there'll be a little give and take there, I think.
That's true.
So I would have to say this. If you can find a restaurant which does not require you to scan the barcode, you definitely have a choice. If all the restaurants require the same thing, and then it leaves you no choice, and you either don't go to the restaurant or go back to your home, you have to follow the rule. That's the situation in China. You can now find a restaurant, and then it doesn't require you to scan it.
The rule is the rule, of course. However, at times there were loosening implementations of the rule. But as a consumer, I do feel there's a lot of there's this trouble that I have to go through in order to get into a restaurant because I have to scan my QR code. But on the other hand, if they don't ask me to scan my QR code, I become a little bit nervous because I do not know actually whether I have a safe environment that I'm going in, because the other places are doing it. So interesting, isn't it, from even an individual perspective, Mr. Chen, about the two sides of the story?
From my experience in the United States, people are quite divided. There are folks who are strong about the protection against the potential risk of being infected. And there are also folks who are not, they don't really care. I think such a system would be very useful, but given the situation, the cultural and also political background in the United States, I think it's going to be a challenge to implement.
Right.
You give you a couple of examples. I teach in a college, in a university, and we have to abide to two major legislation. One is FERPA, Family Education Rights and Privacy Act, and also HIPAA, Health Insurance Portability and Privacy Act. So these two legislation really has a lot of restrictions in terms of how the university, how the college department, and also as me instructor, how we can reveal information. If I know that one of the students in my class, he tested positive, whether I can share that information with others. Those are forbidden by the HIPAA and also by the FERPA. So there's a lot of rules that we need to follow in the States. I think, and unfortunately, I think this may be some conflicts between the contact tracing and these rules. I think if we wanted to implement such a system, we need to sort out these legal implications first.
How do you see the extent of acceptance for the general public at the time of a pandemic? Many would say this is an emergency situation. It is unlike before. So some of the rules and regulations that we used in ordinary days, should they still be the standard that we look at? Should there be some kinds of adjustment to a certain extent with the respect to privacy, but at the same time addressing the urgency of the pandemic? Dr. Huang.
In China are pretty much imported cases from international travelers. And then it's before the vaccine can be widely used, I think China become more like an island, and without much of this infected and immunity built into the people. And then they have a risk to see the imported cases from international travelers.
I wish you were true. However, scientifically speaking, it is not, because herd immunity, I'm afraid Dr. Huang, probably Professor Chen could help us to explain. It has to be a very high percentage of a population to be infected before herd immunity can be developed. For example, with COVID-19, it's likely to be 70 to 90%. That is the latest information I get from the top experts around the world. So that's far from developing immunity that you have been wishing for in certain populations around the world. Let me go to you, Dr. Chen, about your thoughts, what Dr. Huang just said.
Herd immunity probably is not, there are two ways of herd immunity. Having vaccination.
That's one thing.
Vaccinate majority of the population. That's one way of herd immunity. That's probably the preferred way. Having the population being infected and acquire the immunity It's well, it's possible, but given the uh, case fatality rate of COVID-19, I think that's a huge risk to the elderly and to those with pre-existing condition, diabetes, the cardiovascular disease. We want to be able to, well, to protect elderly and those with existing conditions totally away from the risk, right? So yeah, I think herd immunity through the natural acquired of the immunity, I think that's going to be a very tricky, very to some extent probably not putting the lives of the elderly in our objective function. I think if we can make these apps, the QR codes have a good interoperability across different platform, different apps. I think there's a way that we can connect, well, the QR codes in China and QR codes in Australia and those in Japan. I think that's maybe one way we can work with different countries and having a international QR code, which will help in the facilitation or will facilitate the travel of the people.
Given the fact that right now, many countries have developed these kind of apps, and citizens are having the choices to subscribe to, but in some of the European countries that I got to know, for example, only half of the population will use the apps, and that's a debate inside their countries. Huge one, whether to use it or not, to what extent that privacy vis-a-vis public health. We see that is still going on. Given the fact that it is, even 50% could be quite a big goal, do you think globally a mechanism can be really established?
That's a very tough question.
I know.
I think in my my experience in the States, I think probably less than 50% will be willing to take to use the app. Google and Apple actually started one contact tracing app back in April, but I don't think the take-up rate is that high in the United States. So there is a lot of hesitancy towards such contact tracing efforts.
So now what is the solution? Because the world has to move, right? Mr. Towson, you know that very well. You are an economist. And the world economy already having huge dampening effect as a result of COVID-19. We can't let that to continue for too long. Even with availability of vaccination, we'll not be able to reach the herd immunity that we all wish for in short period of time, not within the year, next year, I mean. So what can we do in order to at least to ease the pain on the global economy?
Yeah, I think my assumption from the beginning has been we're going to be learning to live with this because viruses they tend to stay around. We haven't cured very many viruses as a species. We just get better at managing them as they surge and fall over time, whether it's the flu or whatever.
We're not waiting, but we should not do a passive waiting period of time. So what we're talking about is proactive. Do we need to be proactive? I want to just get a word from you. Or shall we wait until the vaccine, until the virus goes away, which according to scientists is not possible?
I think it's going to come down to government ability to execute. China, regardless of what tools you give the government, QR codes, whatever, is fairly effective at making things happen. So is Japan, so is Singapore, so is South Korea. When you start talking about QR codes in California, where I'm from, I don't know anyone who thinks that government can execute very well. The UK did not do a good job. So the tools will change. The situation will evolve, but I would kind of look for management ability as my number one factor for who's going to keep this thing under control going forward.
Mr. Chen, your final words.
Yeah, so I think the direction of having a international version QR code, I think that's a good step towards the right direction, but there would be a lot of hurdles in implementing such a scheme. I think there should be a lot more collaboration, and there's probably also needs cross-sector collaboration. One of my wild guess is that if we can engage insurance company in developing and promoting the contact tracing apps, I think that might help. Yeah, but well, I think that's something that we need to find out.
Very interesting. Certainly, we see this is a hot debate, and what is the best policy? Nobody knows. Probably we'll have to, as they say, groping the stones while across the river. We'll see how the pandemic are going, and how we can have the best policies at different points. Thank you so much, gentlemen, for your input from different perspectives. Jay Huang, Jeffrey Towson, and Chen Zhuo. Really appreciate it. Thank you. Certainly an interesting and heated debate about the QR code. And that's all the time we have for today. If you'd like to see more, search World Insight or check out our YouTube channel. Follow us on Twitter and Facebook. I'm Tian Wei. On behalf of the team, thanks for watching, and bye for now.